Are you tired of dealing with the uncomfortable burning sensation in your chest after a meal? You may be suffering from GERD, commonly known as stomachache or heartburn. In this video, we will explore what GERD is, its symptoms, causes, and most importantly, how you can manage and prevent it. Stay tuned to learn how to find relief and improve your digestive health. Okay guys, the gastroesophageal reflux disease accounts for the 20% of the cases a patient is normally visiting the gastroenterologist. And gastroesophageal reflux, especially after meals, can be physiological. The reflux of stomach acid in the lower esophagus can cause important symptoms which are affecting the lifestyle of the patient. These can be with or without complications that will be discussed in the last part of this video. As you can see in this picture, there is a normal functioning lower esophageal sphincter preventing the reflux of the stomach acid back into the esophagus. So to begin with, the etiology can be due to the incompetence of the lower esophageal sphincter. Under normal circumstances, along with the competency of the lower esophageal sphincter, what prevents the reflux of the stomach acid back into the esophagus are the parts of the diaphragm, which loop around enclosing and exerting additional protective forces on the lower esophageal sphincter. Gastroesophageal junction is the point where the esophagus and the stomach meets, creating the angle of His. It's the part between the greater curvature of the stomach and the esophagus. In sliding esophageal hernia, this angle is diminished as it is moved above the diaphragm. This will inhibit the above-mentioned protective forces of the diaphragm exerted on esophagus, and thus predisposed to the gastroesophageal reflux disease. Moving on to the symptoms a person suffering from gastroesophageal reflux disease can experience are divided into two categories. Diving into the first one, which are the symptoms related directly to the esophagus. Burning sensation known as heartburn, retrosternal chest pain, belching, food regurgitations, dysphagia, and increased production of saliva due to esophagosalivary reflex. Moving on to the second category of the symptoms, which are the extraesophageal symptoms, which are not directly related to esophageal irritation. These include laryngitis, cough, inspiratory wheezing, pneumonia, middle ear effusions, and recurrent otitis media. There is a wide range of diagnostic procedures that can be done. The most common one is the so-called PPI test, meaning giving proton-pump inhibitor drugs like omeprazole or pantoprazole to suppress the formation of gastric acid. If it alleviates the symptoms, it's supporting for diagnosis. This is the test that your gastroenterologist will start with. Endoscopy, meaning esophagogastroduodenoscopy, is very important for the diagnosis, as this will help the doctor visualize your esophagus and take biopsies to exclude other complications. Manometry is a test that a very fine cable-like catheter is passed through the esophagus of the patient to monitor the peristalsis of the esophagus. Further tests can be used like barium meal to exclude the presence of hiatal hernia, presence of esophageal stenosis, or dysfunctional peristalsis. pH metry or pH monitoring is a confirmatory test. A tube passed within the esophagus with a pH probe where it measures the pH. The doctor will then examine the results after 24 hours. Having a heartburn as a symptom, we should always think about more severe and sometimes even deadly pathologies in our differential diagnosis. These include coronary heart disease, bronchial asthma, achalasia, and gallstones, known as cholelithiasis. There are various approaches toward the therapy of the gastroesophageal reflux disease. The first one is the diet modification. There are two types of foods that should be avoided: the acidic foods that increase the production of stomach acid, and the foods that cause the relaxation of the lower esophageal sphincter and thus predispose the reflux of the stomach content back into the esophagus. The acidic foods include onions, beverages, spicy foods, and acidic juices. And the foods that cause the relaxation of the lower esophageal sphincter includes the lipids, the chocolates, the tea, the coffee, and the fried foods. Regarding the lifestyle changes, people suffering from gastroesophageal reflux disease should quit smoking and alcohol, lose weight, eat the last meal 3 hours before bedtime, should avoid wearing tight clothes, and during sleep, the chest should be on a higher level than the abdomen, thus with the help of gravity to prevent the reflux. Medical treatment includes drugs which suppress the formation of the stomach acid, for example, the PPI drugs, the proton pump inhibitors, which are the same ones as the ones used for the diagnosis. Surgery has specific indications. These include young people requiring long-term therapy with PPIs due to the side effects of the medications like diarrhea and headache. Other group is the people that despite the proton pump inhibitor use, they have ongoing reflux, patients which present respiratory complications, and the most dangerous complication, which is Barrett's esophagus. The surgery used is called Nissen fundoplication, where the fundus is wrapped around the esophagus, preventing the reflux. The complications of the gastroesophageal reflux disease are esophagitis. This is due to the recurrent injury and healing, as you can see in this picture, resulting in the esophageal stenosis with fibrous tissue formation. Another complication, and the most important one, is the Barrett's esophagus. This is the epithelial metaplasia of esophagus, from squamous epithelium to columnar epithelium. This will unfortunately lead in adenocarcinoma. Other complications include pneumonia, bronchial asthma, and tooth decay. Okay guys, after we went everything we need to know about the gastroesophageal reflux disease, here is a question. Which of the following is not a complication of the gastroesophageal reflux disease? A. Tooth decay. B. Pneumonia. C. Barrett's esophagus. D. Sliding esophageal hernia. You can put your answers below in the comments. Okay guys, this was the end of the video. I want to thank you people for watching this video. Please hit that like and subscribe button and let me know in the comments below if you have any questions.